And this is my patient today, guys, and we've got some pretty beefy plugs in these ear canals here.
Hefty chunks.
Yeah, pretty big ones. It's a slightly longer video as well, so you're going to be treated to a longer one. So we've got the standard size on the tube on here, and I can already see this was coming away quite nicely to start with. The bulk of it, if I can remember this one, the bulk of it came away okay.
Yeah.
But it's the tidying up and the cleaning which basically takes the longest amount of time.
Oh, look at that.
So yeah, we're trying to hold this grip here. And this is a regular patient of ours as well. I think they attend, I want to say every 12 months, maybe a little bit longer. I think the patient's actually left it a little bit longer this time, but we normally see them on a 12 monthly basis.
Oh, that's stuck.
Yeah, and it's kind of like a parcel as well. It's pretty tough. Patient has used a little bit of oil. I know it doesn't look like it, but patient said they had been using some oil. So we're trying to just keep that grip because that's why I'm wiggling so much. Because every little wiggle is actually, you can't really see it much, but every little wiggle is drawing that forward slightly. Look at the size on that.
Oh, that is a big one.
So that has cleared most of the ear canal. Now again, the longest bit is just tidying up, cleaning these little tiny bits. We're not really overly concerned about these little tiny spots that are, that are around, but there's these kind of slightly bigger ones, you can just kind of see up just behind the tube there. These little bits is what we're...
It looks like there's a lot of skin in here as well, doesn't it?
Yeah, it didn't actually look like a huge amount, but as I was trying to peel it away, it was pretty tough as well. It wasn't just coming away really easy.
Because sometimes you get a grip and you'll see like a whole sheet will lift on you off the canal wall. But it's hard to tell sometimes because that looks almost exactly like staining. Yeah. So you'll find with the oil being not the oil, but the oils from the wax sort of transferring then onto the skin can give you this yellowish appearance. But that's also what keratin looks like, isn't it? Look at that.
Yes, you can see it's just peeling away. It's like breaking little bits away. It's a bit of a frustrating one, to be honest. So the patient's already hearing a lot better, but just wanted to try my best to clear as much of this as we can. There are going to be still little spots that are left, guys. It's not going to be a completely clear ear canal, but we do try to get as much of this skin away. Oh. Problem with this this kind of dry skin, you can use a little bit of oil, but I'm always a bit dubious about using oil after the ear canal has been cleared because if it gets down over the front of the eardrum, it can sometimes be a little bit, tricky to get that oil back out, and the patient might have a bit of muffled hearing. So if the patient's hearing a lot better, then we'd rather just kind of leave it as it is. But the problem with these little bits of dry skin, sometimes you get a little bit of whistling coming from them, a bit of clarinetting, which is not a nice noise to hear.
It's not as if this is the really thick, because sometimes you get that really thick keratin, don't you? And that's sitting on there, and then that you can really get under the lip on the edge. But when it's really super thin, like this is, and it's difficult to give you a concept of how thin this skin is. It's absolutely, it's paper thin. And it just doesn't want to come away easily there, does it?
No. I'm trying to avoid, because we're kind of we are in the bony portion of the ear canal here, and I can't even explain it, to be honest. It's trying to just catch the edge of the suction tube to lift a little bit of that skin, which usually should start to peel the whole thing away, but it doesn't always happen, unfortunately. And it's pretty tough. This is, we're not getting much movement at all. So we've gone over to the other side now. So like I said, we haven't completely taken those little bits of stain in, those little bits of dry skin, but we've advised continued oil and a regular checkup as well on the ears. So it's a very similar story here. Yeah,
thicker skin straight away there, wasn't it?
Yeah, and it's this one actually was more of a pain to take out because I couldn't actually get this plug to pull forwards, and you can see it's really frustrating because I've got a grip and I'm giving it a good old wiggle. I'm trying to push it to the side, and it just doesn't want to detach off the ear canal.
That's stuck, isn't it? That's, as you can see, there's another layer underneath. It almost looks like there's two pieces folded over the top of one another.
Yeah, I think I do try and catch that. Here we go. I do try and catch that bit of skin on the side as well to see if that lifts and pulls forward.
Sometimes if you bunch it all in there at the end of the suction tube, and you'll get that much better grip.
This is more of a keratin here now. This is pretty tough. It's solid, very, very dry, and no matter how much I'm pulling on this, it doesn't want to seem to come away.
No, that keratin is hanging on to that canal wall, isn't it?
But I don't think it's like at the entrance here. I think it's behind where the plug is holding on, essentially, where it's you know, closer to the eardrum. So I'm going in with the forceps here now because it's quite a dry plug. So I'm just going to try and gently give this a little bit of a wiggle. Patient was, I could see the relief on the patient's face as this was starting to come away. He was going, oh, that's nice. He's got, there it is.
The thing is, if you just move it forward slightly, you'll get that gap on you.
Yeah, you can sometimes kind of, the patient can sometimes feel that plug sort of slowly moving down the ear canal as well. And yeah, patient like almost kind of felt like a pop in a way. They were like, oh, there we go, there it is, I can hear again. Yes, it's tough.
God, that is not easy, is it, to get that out? Look at that. Oh, I don't know, we got a bit of a movement there.
It's on its way. Trying to hold that grip.
Wow, that is chunky. So you had that big block of wax at the back, and then you had all that skin at the front there.
Yeah, we got a little bit that unfortunately didn't quite come away. But that little bit at the end is actually quite wet.
Oh, no.
And I think that could just purely be where the patient has used a bit of oil and it's just got behind the you know, the big plug that we've just removed, and it's just kind of softened this to the point where it's quite wet. But we've got this again, this really thick, dry sort of keratin here, just trying to shear it away.
I wonder if the patient's been using some olive oil, you know, regularly between appointments.
They actually said they'd forgotten to do it, but they used a couple of days worth before coming in. I remember that bit, because I did say, you know, you ever been using it regularly? Like, no. Because
the thing is, it would help with this, you know, with this thicker keratin layer, wouldn't it, around the outside edge? And I think maybe if that was a little bit softer, you know, are we looking at the wax holding on in there because it's adhering to that thicker keratin layer? You know, if they were using the oil on a regular basis, whether it would, you know, whether you wouldn't have that dry keratin layer and it wouldn't stick on it, maybe.
God.
That's not easy up there as well. Not an easy place to get. There are certain parts of the ear canal when you look at it from a practitioner's point of view, and you think, and there are certain angles that are really difficult to do, and that is a tough old angle up there.
The roof of the ear canal is always a nightmare, especially if it kind of dips up and kind of gets away from you. Patient was talking to me as well. You can see his ear canal. You can see his ear canal kind of moving.
Oh, look at that peel going on there. There's a big old peel in the background, isn't it?
What I was hoping is this whole side section going down over. I was hoping that was all going to come away. I don't think it does.
You run out of room as well, haven't you? Because you're pulling that down, and you can see where you're pulling it down. You need that, just that little bit more room just to peel that last section off.
Trying to hold the grip, because again it's starting to shear away now. There we go. Patient was absolutely fine through all this as well. Fair play. You know, you do sometimes when we're peeling this like kind of keratin, this dry skin away, you might feel a little bit of almost like a pull, like some resistance. Don't generally get any like discomfort or anything, but it's, you know, it feels really strange. Like how like stretchy and sort of wet and sticky this last bit is though, right over the front of the eardrum.
It's almost like a little bit of surface ear as well. You know,
just that little bit.
Just that little bit of very, very pronounced recess there. Ooh, that's not an easy one.
You know, it actually came away better than what I thought it was. I honestly didn't expect me to be able to clear this from the eardrum, because just the way it was coming away, I thought, you know, we might have to use a little bit of oil here and
hope for the best.
But it was coming away okay. We just got this little bit we're trying to peel away, and if I can get that, there we go.
Nice.
Oh, you could just see it just peeled just behind this. We've pulled that away now. Can't really see these very well. The vision is again quite a tricky one because of that that slight little protrusion on the side of the ear canal there. That wax now, there's a little bit, I've gone back to the dry skin again.
Sometimes you need it just because if you're making the same fine repetitive movement a lot, it's difficult. You do start to kind of almost not seize up, but you become quite stiff. Taking it away. So moving on to a different part of the ear canal and then changing the movement type helps, doesn't it? That's good. Well done.
Yeah, it's a little bit of irritation there, but again, I just think that's, you know, more to do with you know, the size of that plug that was in there, and just how wet that last bit of the wax was.
He's a bit of a beastie, isn't he?
Yeah.
Do you reckon you're gonna be able to peel that?
No, it's not gonna be a clean and tidy one. Sorry, guys, but I thought it was an interesting one to put up just because of the size of the plugs that actually came out at the start. But you can see there's almost like a little bit of what looks like tympanosclerosis on the ear drums on both sides. I don't think that is the case though. If I can remember, this patient's historically has mentioned some issues with ear infections in the past. So sometimes you can see this on the eardrum where almost like the skin pigmentation kind of changes a little bit. But it can happen with aging as well.
Yeah, it can. Yeah, those white cloudy patches. It's more. Yeah, you get it certainly with aging and stuff. You'll get a much more kind of pronounced. If it's sort of damaged the eardrum or infection, sometimes you'll see more localized patches, especially with like a perforation. You'll see the outline of the original perforation on there as well.
Pretty sure you want this to end, no? I did anyway when I was doing it. I was like, come on.
I read left now. Could do one of those bottle brushes. Just go, there we are. Hope that all goes.
Oh yeah, it's all electric now, isn't it?
Yeah.
There you go. Yeah, generally quite a tricky one, just because of these little tiny bits that are.
It's always the
coming away.
thickness of that skin, and you know, if the thing is, if it peels away in big sheets, it tends to be a little bit easier. I had one recently, and the whole ear canal was just the surface layer just peeled away, and you can peel a lot of it with a fine end. And you just go in with the standard size, where you've got enough of it peeled into the middle, you can get a grip on all of it without the clarinetting, and then you can pull the whole thing out. But these little fiddly ones like this are always difficult. You know, in fairness, what you are saying to the patient is you need to use olive oil on a regular basis, and that is going to really help with the issues you've got going on here. So.
Yeah. Oh, I was kind of. I purposely didn't respond to any of the patient's questions at this point because I wanted it to be as still as possible here. But there we are. We've managed to clear that quite nicely. But look how
wide it is.
Not just how long they are, but how thick they are as well. It's 4.5 centimeters worth of plugs there.
1.5 inches.
The worst of that only took like 2 minutes to take out, but it's those little tiny bits to take
tidy ups after, isn't it? Well, guys, thank you again for watching our video today, and don't forget, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe. If you thoroughly enjoy the videos, you can also consider becoming members of the channel as well. That also helps. But as always, guys, take care of yourselves,
take care of your ears,
and take care of one another, and we shall see you again real soon. Bye, everyone.
Bye bye.